So welcome to the September 7th community chat. We've had a little bit of confusion today, which
What do you
pulled us in two directions. The constant contact notice didn't go out till much later because there was a problem with constant contact. 918 is not currently operating, so we don't have a simulcast, which probably accounts for the fact that we have a few more participants than usual. And you will hear, though, those of you who, you're not here to hear my announcement, but there will be a recording that goes into and will be available sometime over the weekend, I believe, of this Zoom that will go into our video library, and you'll receive a link to that from Nancy Vega sometime, maybe later today or tomorrow. So anyway, we have a fairly busy schedule and a lot of things to talk about. We'll take a few announcements before we take and welcome our new president of HSL, who is with us now, Dr. Steve Landers. So Peter Halfon, you go first.
Hi, everybody. I'd just like to start with some breaking news. Yesterday at the Food Committee meeting, after 14 years, we changed the name of the Food Committee to the Dining Committee, which more closely aligns us to what the committee actually does. The thing that I really want to talk about is the message that I sent out the other day. And to make it fast and easy, I will just read it. New members for the committee are voted on to serve a term of 3 years, starting with the October meeting. Several current members who have completed their term will be leaving the committee at the end of September. Please express your interest in joining this very congenial committee for the next 3 years by sending me a short paragraph by September 15th expressing that interest and what you feel you might bring to the committee. Now, that should be other than you're a good cook or you like to eat. Applicants must be a resident of Newbridge for 1 year by October 1st. The committee meets with the food and beverage team on the first Wednesday of each month from 3 o'clock to 5 o'clock. Going forward, we will be evaluating the total dining experience as it relates to our new a la carte menu. We will also continue discussing how to improve the NOSH experience. You will be notified by September 29th of your acceptance. Please send me, I've been getting a few already, send me in your interest in joining this committee. We'd really like to get a good committee. We have a good committee and we'd like to keep it that way. And it should be a very interesting year coming up. Thank you, Jerry.
Can you hear me now?
So Linda Weinstein.
Mute.
You have to unmute, Linda. I'll do it.
I can't get.
Go ahead. You're all set. Go and speak.
Okay. Anyway, on Sunday, this Sunday, at September 10th at 1 p.m., we are having a follow-up to Bill McKibben's presentation about third act and the opportunities and fun that we can have as seniors in doing something that really matters to us and especially to our families. So the meeting will just be an hour. It's in the Winter Garden. There is a message that has gone out to you, which was beautifully designed by Sheila Paley, who I guess is traveling. But anyway, don't forget about it. It doesn't commit you to anything coming to the meeting. It just shows support for the concept and support for our speaker who's coming from another CCRC. We're going to have refreshments. We're going to wear masks, and it's pretty well, there's pretty good air movement in the Winter Garden back towards where the ping pong table used to be. So look forward to seeing you all there. Thanks for coming.
Okay, Judy Obermeyer.
I just wanted to say a few words about the Social Action Committee. We have not met very much over the summer particularly, but we're going to start up again on the 19th of September at 2 p.m. I'm particularly putting this out to, there's a lot of new people at Newbridge, and this is a great way to come and meet some other people and get involved with issues that you care about. Most of the things that the Social Action Group does is because people in the group are interested in working on the issues. And so we really would love to have new people come and be involved. You're not committed by coming and finding out about stuff. So it'll be 2 o'clock on the 19th.
Okay, thank you. So I want to take executive privilege and put another plug in for next Tuesday. That's the Environmental Committee's regular second Tuesday meeting at 2 o'clock. Terry Union asked me, since I know the speaker, to introduce him. It's Mark Margulies. You're going to be one of the first to see an amazing presentation of literally $1 million plan the community is set up as to how to harden one side of Boston Harbor, changing protections to buildings and everything else. And it's I think you'll find it quite a treat. So that's 2 o'clock next Tuesday. So Judy Ehrlich.
Thank you. I have two brief announcements. The first is to remind you all that on Monday, September 11th at 4 p.m. on Zoom, we'll be holding our annual memorial service to remember residents from IL who have passed away starting as of September last year and through August of this year. It's a very moving service and an opportunity for our residents and their family members to speak up and share what they miss about some of the people that we've lost during this year. So that's on Zoom at 4 o'clock. We will not be having an in-person service. And if Channel 918 is working by then, it will be broadcast, but we don't know that yet. The other thing is we have received lots and lots of responses to the high holiday sign-up form for Congregation Newbridge. Tuesday was the deadline, but if you are still planning to come, it would be very helpful to us to know how many people are coming. So please still fill in your form and give it to Joe as soon as you can. Thanks very much.
Thanks. So now we welcome, I'll turn it over to Matt to introduce our new president of Hebrew Senior Life. I deliberately took announcements early on because there are latecomers, and we have, I think, a record number now of 139 people. It keeps getting bigger. To welcome our new president. So you do the intros, Matt.
Sure. Well, hello, everyone. It's nice to see you all. I hope you're all well. I would like to think that Jerry and I are so exciting that we brought in 139 people today, but I happen to know that we have some more to discuss, and Steve Landers, our new CEO and president, is here with us. So Steve, thank you for being here. Dr. Landers comes to us with a tremendous resume, and he can talk about that a little bit. But I just want to talk for a moment about my experience with our new CEO, Steve. I had the opportunity to be part of the interview committee and met with a handful of individuals, and nobody even came close to what Steve brought to the table. And what he brought to the table was a human approach to providing direction for HSL. He is a great person first, and he'll tell you probably, a parent second and a husband and all these other things, but he really has the culture of HSL, and that fit really shined through during the interview process. But what impressed me the most, and Steve, you haven't heard this yet, was when I had the opportunity to give him a tour of the community. He was asking the most pertinent questions. So far from superficial questions, I couldn't believe that he had only known the organization for a couple of weeks. He was asking about the things that truly and genuinely matter. And so that was really moving for me. He's new in his role. He's probably drinking from a fire hose. There's a lot that he's trying to learn very quickly. He is back and in between Boston and New Jersey, where his family is. So he's got a lot going on. And so, when it comes to the specifics of HSL, I'm sure he's just getting his feet wet. So please, let's keep that in mind. And more than anything, this is just an opportunity for you to get to know what a tremendous human being he is and put a face with the name. And so, Steve, I welcome you. Thanks for making time for us. I can only imagine how busy you are. But as you can see, 144 people are on this call. That's a record. We are honored to have you here.
Wow. Matt, thanks so much. That is an incredibly generous introduction. And I can't thank you and Rhonda and the whole team for all the enthusiasm and kindness and assistance that's been given to me. And I want to apologize. You got a sellout crowd here. And I think I've got more of a face for radio. So we'll see how I can do on this Zoom town hall. I am so proud and pleased to get to be a part of Hebrew Senior Life. It is just an awesome organization that, through our work at Newbridge and across Greater Boston, there's just so many great people that are truly caring and compassionate and are experts in their field and really want to make a difference. It's just the type of people that I'm proud to be a part of. As Matt said, I'm coming here after spending the last 11 years of my life and career in New Jersey. Although I'm not a New Jerseyan, I don't talk Jersey. I'm actually originally from Cleveland, Ohio. I grew up in Cleveland, Ohio, spent the first 37 years of my life in Ohio, and a lot of all my training as a physician and as a manager happened in Ohio. I'm very much a product of my parents. My mom, an occupational therapist who became a hospital chief operating officer, and my dad, a family dentist who became very involved in dental education and medical education. They are the people I've always looked up to and wanted to be like, and try my best still to somehow come close. But my family is all in Ohio. My wife's family in the Columbus, Ohio area. And my wife, Allison, is the most amazing person. She's like superhuman, much better business person than I am. And on top of that, the best mom and wife you can imagine. Professionally, she works as the chief experience officer for UBS. So if you do any work with UBS and you don't like it, you can register a complaint and I'll send it to her. But she's an amazing person who, we've been married 23 years and we have 3 children, 17-year-old, 15-year-old, and a 12-year-old, all boys, Eli, Sammy, and Harley. And they've all got their wonderful traits and their unique stuff. And we're having a wonderful time with them. Although teenagers are kind of interesting, but we're focused on the good stuff. And but about 11 years ago, I was working as the head of the home and community care and post-acute and rehabilitation programs at Cleveland Clinic in Ohio and Cleveland Clinic Health System. And it was a wonderful thing, but I got a chance to serve as CEO of an incredible nonprofit organization, home and community care, public health and human services group in New Jersey called Visiting Nurse Association Health Group, one of the largest community and home-based care organizations in the country, a very heavy mission-driven team, 2,000 employees serving people throughout the state. And it was a wonderful thing to be a part of. And even though it was really hard for us to leave Ohio with the kids at the time they were babies, it was a chance for my wife and I to spread our wings and to show that we could do great work outside of our comfort zone and meet new people and see a new part of the country. And we've loved every minute of it, but also looking to the future. What's the next best way to make a difference? How can we keep learning and growing? Show our kids that we're a part of something important, like advancing high quality aging services, leading and innovating, doing something that was born out of the Jewish tradition was important to my wife and I. And of course, meeting the people that we met through the interview process in terms of the quality of people like Matt and other team members shine through. And it was something I very much came to want to be a part of. So we are, working on moving our lives to Boston in a new community. And that's going to be a gradual transition, as my oldest son is a senior in high school, and we're going to let him finish out this year at his school. So I'll be, on the weekends, you'll see me in the airports and train stations, going back and forth. And actually, Allie and my youngest son are going to come up here this weekend, and we'll just do a little touristy stuff. And I'll take the weekend off for travel because it's been 6 or 7 in a row. My approach here right now, as the new person, big shoes to fill with an incredibly effective and accomplished leader in Lou Wolf, who's been incredibly kind and supportive of me and helpful in terms of learning the ropes, helping me learn the ropes. I'm really focused on some basic things, which is building good relationships and getting to know the team. So just trying to get those relationships off to a healthy and trusting start with the rest of the leadership management team, board of directors. Also start to meet and learn key stakeholders in the community, whether that's in the community leaders from our board or donors or other leaders in health and human services. Yesterday I had, we have some affiliations with Harvard Medical School, and I got a wonderful and enthusiastic welcome and great opportunity to spend time with the dean of the medical school yesterday. And those type of meetings have been pretty prominent on my schedule. I've been going around to all of our teams and programs. I've gone to the different parts of Newbridge and met with the culinary staff and said hello to the security, and came back at night and went around and went to the different teams and floors in the hospital setting, and have just been doing that across all the Hebrew Senior Life communities, just to say hello, show my face, try to listen, let people know that they're valued, let them know that the transition is, the transition is going smoothly and that they can feel reassured. And also, I've just been trying to learn. So build relationships, learn as much as I can about the organization and circumstances. There's a lot of stuff that's straightforward, that's familiar topics to me. And then there are things that are unique. You can imagine a place like Newbridge, the whole business model, service model, the way it was financed, everything about it is unique. It's a one of a kind. There's not, you don't know the details about a place like Newbridge from your last job. You got to get it. You got to dig in and get the details once you become a part of it. So I'm spending a lot of time learning, trying not to burden Matt and Rhonda and the team with all my questions about the details, but I'm doing my best to learn, and also trying not to mess up anything that's going well. So as a new leader, I want to be conscious of the fact that there's a lot of things that are going well, and I don't want to be a bottleneck or get in the way with continued progress. So those are kind of the early first things that I'm working on. Longer term, I'm certainly concerned about getting a clear vision for True North for Hebrew Senior Life for the future, a shared vision of where we're trying to go in terms of how we want to grow the organization, what we want our focus to be, what we need to do to improve our teamwork and our processes and systems to be more effective. If there's any areas of weakness that we need to address, make sure our campuses and buildings are in the best shape possible for the future so that they remain attractive places for people to live. And, you know, those are some of the topics that I'll be confronting. Certainly I'm here in many respects because of the opportunity not just to lead at Hebrew Senior Life, but because of the beacon that Hebrew Senior Life is and can be more broadly in elder care. We have such talented people from working on research and new models and teaching and training the future. And that stuff I want to be a part of. It feels like a way to have a real legacy of goodness. And but in the meantime, like I said, I'm focused on the basics, meeting people, showing my face, learning as much as I can, and trying not to mess anything up too quickly.
Steve, thank you. That was an outstanding introduction.
Thanks. Do we have any questions or any statements people want to make to the incoming president? It seems like you've covered the waterfront. That's Marlene, have you raised your hand? Oh, okay.
Steve,
Well-
I'm impressed. I don't think I've ever been able to do what you just did.
Well,
Look, if you count everybody, we have Anna Margaret, but if you count everybody sitting as twos, we've reached audience of 160. We've never reached that. You better come back every week.
I
Steve.
see a hand up with Anna there.
Yeah, Anna Marcus, go ahead. We're not getting your voice, Anna. Go ahead. No. Try again. No, we're not getting you.
Ever check.
We'll go to Larry Brown.
Hi, welcome. And one question: how can we as residents help you do your job?
Well, I mean, you're already doing it by giving me this chance to see all of you and the warmth of the welcome, and certainly staying, you know, in good communication with Matt and his team through the channels. You know, I certainly have faith that you know, any kind of day-to-day issues and things that might come up will be well addressed through those channels. And at the same time, if you think there's something that I'm missing, that we're missing, that I'm not hearing about, or that might be important, please, you know, don't hesitate to send me a note. Or if you think something's going well, one of the most important things that you know, we need to do as an organization, you know, the people that do the work, whether it's, you know, maintenance, culinary, nurses that we have on staff, CNAs, these folks are in high demand. They can go work anywhere, basically. So one of the reasons they stick with us is because, you know, we give them, you know, decent pay and what have you. But the other piece is that they have to be immersed in a culture of gratitude and support. So, you know, certainly I want to hear about, you know, if something's not getting addressed in the channels that you're going through, you're not getting the feedback. I'm always okay to hear bad news. But any compliments, praise, any enthusiasm for the people doing some of the work, you either cue me in that there's an opportunity to recognize someone, or Matt, or, you know, also please, you know, spread the kindness, because I think it changes folks' days when they hear a compliment or a thank you, and that changes their attitude toward work, and it might help us keep that person another few months or another few years as part of the team in an environment where it's not always that easy to maintain the workforce. It's a fascinating time. I'll comment on an interesting thing I was looking at about Norfolk County, Massachusetts, which I believe is where our new bridge is, in our sister community, Orchard Cove, is in Norfolk County, Massachusetts. Over the next 15 years is going to almost double the number of people age 85 and older. However, it is going to stay basically flat in terms of the number of people aged 20 to 65. So when we think about the age groups that we typically need to recruit workers into to work in services and supports for an aging population, we're having an increase in the number of older people. Now, hopefully many will be vibrant, healthy, and not need much supports. But to the extent that there are needs, we're growing that group, and we're not growing the younger group. So we're in a very competitive environment for workforce. And actually, Hebrew Senior Life, one of the things we're doing is both working to try and create our own talent through education programs, recruit people even that are moving new to the country to become part of the team, which is really important strategy for us. But that market is not it's not booming with potential workers. And one of the ways that we can keep people is that for the culture, the sense of gratitude, the sense of that their work is worthwhile and it's a meaningful opportunity for them to leave a legacy in their life. The more they hear that, that will be big help.
Thanks. Are there any other questions? Well, thank you for coming, and clearly, you created a great deal of interest. This is the biggest welcome we've had for anybody. And come on anytime if you have anything else you want to say or get an immediate reaction from a large group of people.
Thank you so much. And please, everyone, have a healthy and sweet new year if I don't see you. And I'm looking forward to continuing the partnership. Thanks for having me.
Thanks. Matt?
All right, thank you very much. I think Josh had a couple things he would like to share before we jump over to me.
Yeah.
Go ahead, Josh.
Thank you, Matt, and thank you, Jerry. I just wanted to add one thing before I have two brief announcements, and it kind of piggybacked what Peter had started communicating. I want to thank Peter for leading the chair of the dining committee, newly named. And I also wanted to thank Benita Ross and Judy Rosenthal. They are the two members who have served the 3 years and will be vacating. And it's not just about the monthly Wednesday meetings. The availability, the support, the feedback that everybody on the dining committee gives is extremely helpful in contributing to the success of our dining operation. So I just wanted to say a thank you to the three of them specifically and the entire dining committee. The two announcements, I just wanted to kind of touch on some queries that have come. One of them being about current COVID protocols and how it may or may not affect the high holiday dining. We are meeting as a team Monday through the dining group and other leadership to make a determination, assess the situation at that time, and if there are any changes to protocols that will affect dining for the high holidays, that communication would begin on Monday and in what form. So I just wanted to address that. Some of the other queries I have gotten are in relation to the Centro menu. As you know, back in August, we went to a new format of the dining menu in Centro. And one of the questions is there's been some question of when it might change, and there's been some confusion and speculation. Our plan has always been to change it quarterly. And that doesn't mean changing the entire menu or the dynamic. It means looking at items that are seasonal, making the necessary changes that make sense from a seasonality standpoint, and also looking at what we call a product mix. And that means we're able to pull information about which menu items move very well and which items may not be selling and being consumed. And we would also look at either revamping or changing those. So we will be presenting, putting together some ideas and options and sharing those at the next dining committee, sorry, still getting used to the new name, in October. And our plan would be for the Centro menu to institute those changes in November or by November. So I just wanted to address, those were two queries I had heard recently as I was speaking to residents and staff in the dining rooms. So again, Jerry, thank you for allowing me to speak for a few. And Matt, I hope I didn't take too much of your time.
That's fine. We have a question from Sid Josephi. So hang on a minute.
Sure, I'm not going anywhere.
Josh, today I went onto the Touchtown to see what the daily lunch special was at Nosh, and it was still last week's menu. I had to call Nosh, and I hate to bother them, to find out what the daily soup is or the special because it's just out of date.
Okay, Sid, I'm so sorry. I will look into that. Do you know, because you had sent me an email about it regarding the dining website, but you're saying that when you went through Touchtown, it hadn't been
Yeah.
updated? I want to make sure I understand
Yeah,
what you're
that's right.
communicating.
That's right.
Interesting. Thank you very much, and I'll look into that, Sid. I appreciate
Oh.
your feedback. Yep.
Thanks.
Okay, and Paul Travinsky. You have to unmute, Paul. There, no,
Commenting about the incidence of COVID in our community at the present time, could I ask about the status?
we get back, we haven't started with Matt yet. Somebody asked him earlier. That's on his list of things we'll take. So let's just take the questions that have to do with Josh or anything before Matt comes. Ruth Glazerman.
Will there be any bulk buying opportunities for the holidays, like as we've done in the past?
Yeah, Ruth, thank you. We were looking at that from the aspect of, what we had available and bandwidth. So I would ask anybody that's interested and has ordered the bulk before. We didn't advertise the bulk order forms. The last time we did it for Rosh Hashanah, there wasn't a lot of interest. So if anyone is interested, send me an email and I will check with the culinary team, communicate back if we're able to accommodate it, and put together in the form of a request and communicate back. So that's a great point, Ruth. I'm glad you brought it up. Those forms had not gone out. And so anybody can just reach out to me and I will respond with an answer. So thank you.
Judy Goldman, you had a question?
Yes, Josh, given the COVID situation, are you continuing the buffet in Copper Beach?
So great, Judy. Thank you so much. What we are planning and have been doing at Matt's direction immediately was to make it more of a manned buffet. So we are pulling it away a little bit and having a staff back there to eliminate the close proximity and congregation that we sometimes see when residents are gathered and serving themselves. So we're hoping that will help. There is no evidence that there's a direct correlation between COVID and consuming food and it spread that way, but out of an abundance of caution and for perception reasons, we decided it was a good move. So that was a direction from Matt that we, agreed with and immediately acted upon.
Thank you. That's a great idea.
Any other questions before we move to Matt? Okay, Matt, you're
All
on.
right. Thank you all very much. As you can see, Steve Landers is a tremendous guy. I think he's going to do a wonderful job for us. Before I get into the COVID space, I do want to share some good news. Our very own Lynette Charles, who is our administrative assistant, has been promoted. She is now our executive admin because her role and the work that she's been doing far expands beyond what she was hired for. So she's just done such an incredible job that her role keeps growing. So when you see her or talk to her on the phone, please congratulate her. She's really just done a tremendous job for our community. So now to the thing everybody's been waiting on. We have 16 COVID cases here on campus. And this started basically the 1st of September. There has been a lot of spreading amongst groups that are with each other often. There's also concerns around another group that gathered together. With that being said, about 50%, we can see that there's direct contact that it spread through. The other 50%, we haven't been able to put our hands exactly on to determine what caused that. As we have seen with this variant, which I'm guessing is probably the XBB 1.5, but you can't be sure unless you actually run lab tests on it. It is highly transmissible. But in terms of severity, which they don't finally know yet, but it seems like severity isn't as bad as the ones in the past. But those of you that have it or have had it could probably communicate that more clearly. The protocols that we put in place, I started setting those up, believe it or not, on Saturday. And then as it grew a little bit, I put more in place ready to roll out for Sunday. And then of course, Monday. So was working all weekend, and then Tuesday morning was able to actually implement the protocols that you saw out there. Now, I imagine there are some mixed feelings about the protocols, but the reality is this is an opportunity for us to slow this thing down, get a feel for where we are, and hopefully just see it in our rearview mirror for a little while before we end up back with another COVID surge in the future. The reality is COVID's not going away. It's not going to go away. The tools we have to handle it, though, are very good tools, and we know how to handle this. So for that reason, you know, I'm not panicked by any means. I feel like I'm a COVID manager first sometimes and an executive director second. So we are well prepared to handle this. Over the last 2 days, the case count has significantly decreased, meaning the amount of people that are getting it has gone down drastically. We anticipated the increase, and I anticipate a couple more days of increases just based on couples and people being in close proximity to each other. Ideally, what I would like to see is by next Monday or so, some people testing negative and no more growth in terms of the people testing positive. No more folks testing positive. From the state level and the county level, the data is fairly unreliable at this point. What they're tracking happens to be hospitalizations. That's only helpful if you want to know how many people are in the hospital. There's so many people catching COVID that are not reporting that it's hard to go by that data. What is helpful happens to be wastewater data. And the wastewater data is separated into two categories, north of Boston and south of Boston. In the south of Boston data, you can see a little spike, which would correlate to what we're experiencing here. So here's the thing. Please mask. It's not mandatory, but we are strongly recommending that you do mask. For our employees, it is mandatory that they mask when they're in resident spaces. They have a right and decision not to mask away from those spaces if they're wanting to subject themselves to risk. But when they're around our residents, they work for us here at Newbridge, and we're not going to allow that to happen. When it comes to programs and activities, I want to make sure we leave as much in place as possible, because I truly believe that social isolation can be equally as dangerous. And so I want to make sure those opportunities still present themselves. But this is where it takes all of us as a community to take responsibility to make sure that we're keeping each other safe. Make sure you're masking, make sure you're washing your hands. If you can avoid talking close to somebody right now, please try and do that. And we'll be through this fairly quickly. If you're dining in the dining room, I recommend having a conversation with the folks you're dining with to make sure they haven't had any exposures. Otherwise, it's just going to keep going and going. What I don't want to do is get to the place where we shut down the dining rooms. For a handful of our residents, or maybe even more, that is the primary social outlet. That's the primary way that they get their nutrition. And it's a really key component to living in a community like this. And I firmly like to believe that we have really learned how to manage this through our 3 years of dealing with it. It's by no means awesome. And for those of you that have it, I hope you're doing okay. You've been on my heart and in my mind. And I've been spending all of my time trying to think about, is there anything that we are missing? Right now, based on where we are, I feel really good about the things that we've done. As an administrative team, at this point, we've done as much as we're going to do. Now, I have to push it back to all of us as adults to make good decisions from here on out. I wish COVID never existed, but here we are. So with that, I'm going to take some questions. I'm sure there's quite a few. We've been through this song and dance many times. So, you know,
We
I
got
can go on and on.
and then Mayor Fine.
Hi, I'm curious as to two questions. Whether the RSV, what is the difference between that and COVID? You know, because I got a shot the other day, and I want to know if I went through that, if it was in vain. And
So, yeah.
are the people in the cottages getting the COVID as much as the people in the big house?
Okay, good questions. So I'll start with your second question first, Rona, if that's all right. We do have folks in the cottages that have COVID. Are they getting it as much as the folks in the big house? Probably not, just based on sheer volume. I think it's more of a ratio thing, but there's a lot of intermixing that happens. So that does exist. The RSV vaccination. All right. I think I've said this before. I'm not a physician. I will give you my take on it. And my take is you should consult with your physician, because RSV typically impacts two groups. It's young children and older adults, usually who have some kind of comorbidities. So your physician might say, you know, you're healthy as an ox. I don't know if you need it. Or they might say it's a good idea for you. My best recommendation would be to communicate with your physician and ask them if they think it's a good idea for you to have the RSV vaccination.
Mayor Fine.
So before the meeting started, there was a little bit of discussion about Newbridge testing for COVID. And the consensus was that basically the people come up, they test you, they watch it for about 3 minutes and then they leave. They don't wait 15 minutes. And, you know, there's a question of whether it's necessary for 15 minutes or not. I would suggest that maybe their process ought to be if 3 minutes is sufficient and that's when they're leaving, that's okay. They should leave the test so the resident can watch it for the rest of the time.
Sure. I've had this conversation with Jerry and communicated with Victor and the security team. So they're all over this. And thank you for bringing it up.
Okay, Sid Josephi and then Roz.
Hi, we were just at the doctor for a regular appointment today, and she was talking about that there are going to be 3 vaccines for COVID and that we should think about getting all of them. So I know that you probably don't know what it's going to be, but I just thought I would put that out there.
Thank you, Sid. That's the first I'm hearing of that. We've been in touch with Dedham Pharmacy. They're waiting on their shipment of the new vaccine that's supposed to come out mid-September, so next week. And then they'll be looking to do a flu vaccination at probably the end of the month, because timing for the flu shot, you want to have it at a certain time so it gives you enough coverage through the flu season. So those are the 2 conversations that are having with Dedham Pharmacy right now. We're trying to get them to commit to a date, even though they don't have the actual vaccine and boosters on board yet, just so we have something to communicate out. As soon as we get that date, we'll put that out there. We'll get people signed up. David Rader is going to run the clinics for us in IL, as he has done in the past. And so you will be able to get your COVID booster here at Newbridge, if you so desire to wait that long. And you will be able to get your high dose flu vaccination here at Newbridge as well. So
Do you know, we had COVID at the beginning of July. How do people know, or do we need to know what version we have?
So what I've read, and any of the physicians on the call, please feel free to jump in. What I've read is that if you've had COVID, regardless of which version, your body has built up some antibodies to it. Unless the version has mutated so much so that your body cannot recognize it, which in this case, if you had it in July, it probably should be able to recognize it. You most likely have some immunity towards it at this point.
Very good, Dr. Hollingshead.
Yeah, thank you.
Thanks, David. Roz Holt.
Matt, I've had the virus this week and I'm due to be tested tomorrow. So if I'm negative, although my daughter who's a nurse says I'm not going to be negative, can I have the cleaning lady come on Friday? Can I have her come if I'm negative?
You can, Roz, and I'm sorry you're not well this week. If you need anything, please let me know.
Okay, thanks a lot.
Absolutely.
If I'm not negative, I can't have her.
Correct. I would say let's hold off on exposing a staff member that travels to a bunch of other units.
Right. That's
I would
what,
just increase the.
thank you.
Josh.
Thank you, Jerry. I received a chat message that I think I should just address, universally, rather for those that may not get the chats. The question was about, will guests be allowed for the communal dinners for Rosh Hashanah Friday and Saturday? And the answer is, as of right now, yes. Of course, the deadline for the reservations and pre-order was yesterday, so hopefully residents who are inviting guests have already turned those in. And again, if there is a shift, that determination will be made on Monday and communication would go out. But as of right now, for the high holidays, we would allow guests because that was the original plan. But it is a fluid situation, as Matt had mentioned. So we will be looking at it on Monday and communicating any shifts. Thank you.
I would say hope for the best, prepare for the worst in terms of guests. Our goal is with the high holidays around the corner to just put this out and have no more concerns and, you know, be able to invite the guests in and have everybody have the meaningful and sweet holiday they were looking for. If we're not in that place, we're going to do what's best to keep the community safe, because we do not want you.
If we have no more questions on COVID, we'll move on to, I guess, 918.
Yeah, so 918 went down yesterday.
Wait a minute, we have Edie Luskin is raising her hand. Go ahead. Unmute.
I can't. Wait a minute.
You're all set, Edie. Just go speak.
Okay. I have a question for Josh. As far as I remember, you are to make reservations for Rosh Hashanah and Yom Kippur a week in advance. A week in advance for Erev Rosh Hashanah, of Yom Kippur, excuse me, is on a Sunday. Who will be there to answer the phone on Sunday?
What you want to?
Josh?
Are you talking for Centro?
Yes.
Okay, well, there's an online reservation that would be available, but Centro is closed on Sundays, so then it would be Monday morning. That would be the first time you would be able to reach someone by phone to make the reservations for that Sunday.
Well,
But
if you don't use the computer and you want to use your phone, your chances of getting a reservation are far less.
Okay, Edie, it's a good point, Edie. Based on what we've had in the past, we don't anticipate, completely selling out for that, but I will speak to the team, and if we want to maybe open it up one day early, so that Saturday, while there was someone at Centro, I can consider that.
That would be helpful.
Okay, let me just follow up with the team, and I can include that in a separate communication.
Thank you. That's very generous of you.
Okay.
Thank you for bringing that up.
Sandy August.
I have two things. One, Josh, it has been advised that Zalman not go anywhere, and I did leave you a message and wondered if you got it.
I didn't. I'm so sorry, Sandy. Did you leave me a voicemail or did you send me an email?
No, I left you a voicemail about Friday night and Rosh Hashanah.
Can I call you right after this call and on the sidebar?
Yes, and the second question, I'll be here, you can call me. And the second question is, if we have guests here, can I allow, and we probably won't, but if we do, we will be outside, but two of the kids want to go swimming. Can we let them do that, or you'd prefer not?
So, Sandy, I imagine this question is for me, not for Josh.
Yeah,
So,
that is for you.
yep, I would say visitors are allowed in the building right now, so I would want them masked as they move through the building. And when they go swimming, that's fine as long as they put a mask on immediately after basically leaving the pool environment. The
Okay.
pool itself has two things going for it. Number one, it's chlorinated. And number two, because it's chlorinated, it's incredibly highly ventilated. Maybe the most highly ventilated space here on our campus.
Okay.
So with that being said, also be mindful though, if there are other people utilizing the pool, I would prefer that you utilize it with the grandkids during a time when it's not being used.
I understand. That's-
Okay, let's move on then.
I
Matt.
have a question,
What? Who's raising their hand?
Ann Barris.
Okay, go ahead.
I'm concerned about going to the synagogue for Rosh Hashanah and Yom Kippur. I have relatives who really would be very concerned about being in a crowd. And I'm wondering if we'll be able to see it on 9/18 like we did in the past.
Well, that leads right into the next topic that Matt has. Why don't?
All right, Ian, thank you for setting us up. As you know, it's been a tough week. So if COVID wasn't enough, 9/18 going down didn't help anything any further. Tomorrow, we have our vendor coming on site and meeting with our IT team as well to try to identify how to get 9/18 back up. If 9/18 comes back up, that'll be great news. Rabbi Judy, I don't know if there are plans to broadcast it or not.
There are plans not to broadcast it. We've had, even when 9/18 has been up, when we were live streaming it, including last Rosh Hashanah, we've run into a lot of technical problems with microphones going down in the midst of a service. And our thoughts were, prior to this new outbreak, that people are really able to come downstairs and participate in the service and that it would not be live streamed. If 918 is up, we will rethink that decision, but it will really depend not just on the live streaming, but on the ability to coordinate the mics and get it to be smooth, because I really don't want it to go down mid-service as it did last year.
Thank you, Rabbi. So 918, we're going to call that a work in progress in the moment. Ideally, we're going to get to a place where we rip everything out and just start over with the state-of-the-art equipment. But we're having a little bit of a challenge getting the right vendors and the right things happening there. So stand by, more information to come on that one. Today, I think you all probably noticed that we're in the community building. We had a blood drive happening. I'd like to publicly thank Christina Rice, who worked really hard to get this up and running. When I was there were 38 people signed up to give blood. That's a lot of lives saved. So for those of you that gave today, thank you very much. It's quite a thing that you've done for your fellow human. And I just think it's very cool that we do this. And then lastly, just a reminder, this Sunday is the Needham Jog Your Memory 5K walk. For those of you that are signed up, I'll see you there. Should be a nice event. It is every single year, and it goes to caregivers that are helping those with cognitive decline.
Okay.
Question up there.
We have a question from Carol Klingon.
This is the question on a topic that has not come up all meeting. Just before I signed on to this call, I got a voice message telling us that starting next Tuesday, they're going to be coming around doing the cottage doors at long last, starting in my pod. This is before your time, Matt, but I remember there was a time when we had workmen here on Rosh Hashanah and it was not very well received and they had to take them away. So I'm hoping that somebody has thought about that and not scheduled them for those days, but if you have to undo it.
Carol, that is terrific feedback. Fernando is indeed on this call. So Fernando, I'm going to imagine that you hear that loud and clear.
Yes, I do, and we do take that into account, and no one will be working on the no work days.
Thank you.
Thanks, Carol. Good one. And with that, stay safe, everyone. I'm here. I'll continue to update the COVID numbers weekly. It's a little much when the request comes in to do it daily. We're managing all of this stuff. It's very fluid. Right now, whether it's 16 or 20, what matters is that you make good decisions, and we'll get through this thing together as quickly as we can.
And remember that while 918 is down, you'll hear from Nancy Vega for those people you meet who say they missed the Zoom because it wasn't on 918. You'll be able to see the video recording. Oh, and we have another question from Sid Josephi. Go ahead.
It just dawned on me, since people are going to be using the plastic containers more often while this is going on, please remember that don't throw anything black plastic away or recycle it. It does not get recycled. So anything that comes from the dining rooms, anything that's plastic, whether it's clear or black, just clean it out, please, and put it in a paper bag and put it behind the concierge desk. And there are people in the greater Boston or New England community that can reuse these.
Okay, thank you. With that, thank you, everybody. We'll see you next week.
Take care, everyone. Stay healthy.
They got your arm.